Hi, folks. This is Alexis Bach with another NAMI Cares podcast. Today we're with Lori Husky, the president of NAMI Kane County North, and our topic today is stigma, and one of the things that NAMI seeks to do is to cure the stigma surrounding mental illness. So, welcome, Lori.
Thank you. Thank you for having me back.
So I have a bunch of questions to ask you again today.
Certainly.
And I'd like to start with a general overview. How many people in the U.S. actually suffer from some degree of mental illness?
NAMI statistics are 1 in 5, which is 20%. So we all know someone who is really struggling with some sort of mental health issue.
So mental illness knows no cultural, economic boundaries at all.
Mental illness doesn't care who you are, what your financial situation is, what your education background is, what culture you come from. It's a biological illness that can strike any human being at any time.
What typical stigmas are placed on the mentally ill?
Well, first of all, I'd like to give you a little definition of stigma that we hand out during our family-to-family education course. Stigma itself is considered an invisible mark of disgrace or dishonor. NAMI says that stigma in mental illness is the banishment and scapegoating of people with mental illness whose conditions are considered so fearful, so repugnant, that they are judged to deserve their fate. I think it's a pretty powerful statement
It is.
On stigmas. And I'm happy to say that things are changing because of people in the mental health movement who are now speaking out. We're finding a little less stigma. We're finding that people can be more open. They are given a voice, but it still persists. And many people, I think when I facilitate a family support group, one of the biggest issues for families and their loved ones is whether to tell your workplace or not that you have a mental illness. Many people still believe that they're going to lose their jobs, that they'll be considered weak, inefficient, that there's something that they could do about that they haven't done. That's one of the biggest ones. And the other thing is how we make adjectives out of mental illnesses. I hear it constantly. Oh, she's so bipolar today. Oh, let's not talk to so-and-so. They always act so schizo. These are hurtful terms. They don't define a person. They are simply the illness that they have.
I would add, I hear crazy all the time.
All the time.
Or psycho.
Psycho is, in fact, our affiliate had quite a verbal back and go a number of years ago it was a haunted house here in our area, and it was called Psychosis. And we asked them, please just change the name. And that went on for quite a few years. They finally moved from this location to somewhere else. I haven't followed. But to consider giving power to that name, that it's something we should be afraid of or, really fearful or, that these are people that could harm us it's that stigma.
Well, that's what it seems like, is that there's just this pervasive underlying fear. And then on one hand, and then on the other hand, there's also, how do you deal or interact with someone with mental illness? But that's another conversation for another day. Mm-hmm. How are people with mental illness stigmatized by, I like to address basically 3 groups of people: the family, the general public, and even doctors?
Family is a huge issue. We hear this constantly in our family support groups, that the people that they thought they would be able to count on the most for love, understanding, and support were generally their loudest critics. We hear often that, if you would only have done this, or this when he or she was this age, this wouldn't be this way. Tough love, that's what you need to do. Most of it is unsolicited advice from family members.
This is true.
And probably well-meaning, but there's an ignorance there about what they're saying. And I don't mean that in a hurtful way. People just don't know. They don't know what to say. They don't know what to do. So they blame the family for bringing this illness onto their loved one.
How about the general public?
Well, we see that. I overheard someone say to me that her husband didn't like her to stop at the Jewel grocery store nearest Ecker Center because those people are over there shopping. And that's a stigma, because the suggestion is that they're violent or scary, or they're going to rob you, or, oh, please, that's unfair. Again, we talked about job issues. That's always a big thing. I bring up a story about my son who he was always very open about his mental illness with his employers, because sometimes medications or whatever, might interfere with performance. And one day he went to work and really started noticing that a coworker who he had gotten along with very well was avoiding him. And he finally asked her, "Have I done something to offend you?" And she said, "Well, now that I know that you're on all those meds, I'm afraid you're going to come in and shoot us all up sometime."
Oh, my gosh.
He called me from his job in downtown Chicago at an architecture firm in tears, a grown man, because that perception is not compassion or understanding, but I want you out of here. I don't want you around us.
It's like instant judgment without actually
Absolutely
understanding or knowing the person as an individual.
Yeah. And even doctors, I hear often from people who are dealing with mental illness that they're looking for a new doctor because they don't find perhaps the compassion and especially the education about mental illness. If you go into an emergency room, most ER doctors have very little training, very minimal training on mental health. So it really behooves all of us to become advocates for this group of human beings who are vulnerable.
So can you give me some examples of how we can open the conversation around the stigma surrounding mental illness?
Yes. Somebody I love has mental illness, and she often tells me that people say to her things like, "You don't look like you have a mental illness." Well, what does that look like?
Yeah.
You don't look like you have diabetes, or you don't look like you have cancer. And when she gets advice, she suffers from severe anxiety disorder. And she's often told, "Oh gosh, so many people have it worse off than you. What have you got to be anxious about?" Her pat response is, "I'm sorry you feel that way," because it shuts down that conversation right away.
That's a really good response.
It's a wonderful response, and I've started using it myself. I would say education. For those of us who are advocates, we really encourage educating yourself before you place yourself in a place where you think you are judge and jury. Learn a little bit more about it. And I have great faith that people are willing to do that if they know where they can get that education.
And definitely NAMI is a place where education is free.
NAMI, all of our programs are free. And let me tell you about a few programs in Kane County that offer education. The Kane County Behavioral Health Committee offers a program called The Layman's Guide to Mental Illness. And I am trained to go and offer that program. It only takes a half hour, and that includes question and answer time. It's just an eye-opener for people. So please invite us to your business or your house of worship. We'll be happy to do that, and it doesn't take much time. Mental Health First Aid is another wonderful program. I took that course myself. Most places it's offered free. In fact, St. Joseph Hospital here in Elgin just had the program. And oh my goodness, it just arms you with information on how to be empathetic, how to be proactive, and hopefully see people that might be in a mental health crisis in a different view than you did before. As you said, NAMI offers things. We have our family-to-family education program, which runs 12 weeks, although that's being revamped, and it looks like it's only going to be a 10-week course now, which for those of us who teach it, that's wonderful. It is free, and I would encourage anyone who has. It's not just for families. If you have a best friend with a mental illness, if you have a family member, if you have a coworker that you know you're going to be working with for a long time, please come and take the course. It's free, and it'll just give you lots of tools and information. And of course, we have our family support groups, family and friends support groups that are open to anyone that loves somebody with a mental illness.
You know, I can honestly say from personal experience, I have gone through the family-to-family course, and it literally changed my understanding and how I view mental illness. It was great to be able to share my experience and not feel that I was alone with other parents. We had mostly parents in our family-to-family group. And as a mother, you know, you just can't keep going back and saying, what did I do wrong? You know, that seems to be a central theme. And I understood now that it's not me. And I understand more the mechanics of the disease.
Right.
And it was a life-changing experience for me. So I can definitely say, you know, if anyone out there has not gone to family, that they really, really need to if they know someone or they care for someone who has mental illness.
Our affiliate will be offering a course again in the fall, generally towards the end of September. We don't have a date set yet. We're waiting to hear from NAMI National when the new program is ready for us to roll out. So I'll be announcing that on our Facebook page and in the community.
Okay, let's say I'm having a conversation with a person and they refer to mental illness or someone who's mentally ill with terms like crazy. Okay, what is a good way to respond myself to educate the person about stigma and about how they're viewing mental illness without coming off aggressive?
That word is perfect, aggressive. Most of us, when we're passionate about something, we often have aggressive rather than assertive answers to things. It's best to say, perhaps you don't know, I have somebody in my family who has mental illness. It really bothers me when you use that word.
That's a great idea.
Or you could even say, it really bothers me when people use that word, because
then it's not confrontational, like you are using it. It's more of
because my belief is that most people are compassionate and empathetic. And we just need a little nudge once in a while to be reminded that our words matter. They do matter. And crazy is a word that can be used with lots of different connotations, but generally we mean it as out of control, or we should be fearful. We should step back from that person, and that's not a fair assessment. You know, I could give you lots of responses to things, and I've given you two that have been helpful in my family situation. But I think the best thing to do is to, as I say, educate yourself and become an advocate in a small way. And it can get down to saying to someone, it bothers me when people use that word. That's a simple thing. And you can use that if you're talking to somebody at the grocery store. You know, that's advocacy. There are many agencies in the Elgin area who offer programs, literature. We have the Ecker Center for Mental Health. We have the Family Service Association of Greater Elgin. We have the Greater Elgin Family Care Center. It's not Presence, it's Amita Health now at St. Joe's. They have a behavioral health center there. They have literature. Perhaps a social worker might come and talk to a group and give you tips on what to say. And I'd also say, if you know somebody in law enforcement or that deals with anything to do with the police department, dispatchers, fire department, really encourage them to get CIT training if it's offered.
What does CIT mean?
That means crisis intervention training. And we are finding nationwide that it is saving lives, not only for our law enforcement, but for the people we love who have mental illness who might be acting out. And it's a way to de-escalate and try and get them help rather than jail, because we know jail is not the answer.
Well, I'd like to thank you today, Lori, for your time. We're out at our remote studio today, so you may have heard a couple cars whizzing by. I'm Alexis Bach.
And I'm Lori Husky from NAMI.
And this is NAMI Cares. And stay tuned for our next informative podcast.
Thanks. See you next time.
Bye.
Bye.